Well, welcome back to Taking the Pulse, a healthcare and life sciences podcast. I am Lynnsey Baker with Maynard Nexon, and I'm joined today with healthcare attorney Lauren DeMoss. Hey, Lauren, how are you?
Great, Lynnsey. Thanks for having me today.
I'm really excited, I know we both are, to delve into this discussion because it's a hot topic right now. We are joined with CEO of Inflo Health, Angela Adams, and Angela is a leading figure in healthcare technology who has advanced the industry by translating artificial intelligence into healthcare outcomes. And get this, she's been doing that for more than a decade. In her role at Inflo Health, Angela leads the company in improving radiology follow-up care for hospitals and imaging centers. So, Angela, I find this fascinating. You've been doing this for more than a decade when AI is really just coming into everyone's everyday fold currently with like ChatGPT and such. So why don't you give us a little bit of background and your clinical background with Duke Medical Center and what led you here today into Inflo Health?
Yeah, thank you both for having me. I'm really honored to be here. My background is clinical. I started as a nurse in the ICU and specifically cardiothoracic, so mostly heart and lung transplants at Duke. Way back, we won't even say the age. I don't want to give that away, but I really learned a lot about critical thinking, patient pathways, quality and safety. I loved being a nurse, but as you can imagine, the health system is a really tough spot to be in. It takes an emotional burden, it takes a physical burden. And so I was like many and had clinical burnout within really about 8 years of becoming an ICU nurse. So I was thinking to myself, how do I still promote patient safety, still be true to my mission and my values, be able to use my clinical background? And a couple opportunities presented themselves. Number one, legal nurse consulting. So I left the hospital to become a legal nurse. I was an expert witness on multiple cases, did both plaintiff and defense, and I learned so much. I wish I would have like reversed the order almost, like what I learned in the legal and documentation and like, man, just the puzzle picture that it becomes if there's a medical negligence case. Wish I would have known all of that stuff when I was practicing at the bedside. But that's what I did first and foremost. I went through a couple in a row of medical device malpractice claims where it was like, who's to blame? The medical device company that didn't appropriately educate the staff on how to use the device, or was it the hospital and the clinicians? And I ended up getting offered a job by a medical device company to come and write a quality program for them around safe usage of their devices. So that was like my big segue into corporate America. I was overwhelmed by it. It was an $11 billion medical device company. And of course, I was coming out of being a clinician for that time period. On that journey with medical device, they put me on my first mergers and acquisitions team where we were going out and looking at really cool technologies, really cool devices that made sense for us to acquire. And I ran into my very first startups. And as soon as I saw the startup world, I was like, this is my people, this energy, this level of problem solving, this level of speed to value, like this is where I want to be. And at that moment, we weren't calling it AI. We were calling it predictive analytics. We were calling it, there were so many words for it back then. But it was really using high quality, high volumes of data to predict what was going to happen to a patient and still predict it in a time frame where you could take an action to prevent it. And that's the very first company that I went to, Javion. We competed with IBM Watson and some others in the field there. I don't think healthcare was quite ready for it. They were still dealing with like checklists and charts as far as quality went. They weren't really ready for us to look at thousands of data points from an individual level, put those together in a prediction and tell them how they could prevent this from occurring. They were still just actioning right what was in front of them. But we had a successful company. We had a successful exit from that company. And that's what led us to start Inflo Health, with the mission of helping health systems never miss a follow-up around radiology follow-up.
Angela, your background is fascinating. I love it. And I love the idea too, like the legal nurse piece of it. And I think you're exactly right. It seems like every clinician should have some sort of foray into that area, in terms of informing their own clinical practice. So that's so fascinating. So thinking about radiology in particular and recommendations for additional imaging, it's my understanding that roughly 60% of those are often missed, the recommendation for additional imaging. So can you talk to us a little bit about the cost of missing, the need for additional imaging? Because there's obviously a financial piece, but then there's also kind of the human emotional cost of missing something that additional imaging needs to be done for. So can you tell us a little bit about that?
Yeah, I mean, first I'll tell you a very near and dear story to all of our hearts and why we picked this as the patient gap to solve next with AI and automation. One of our colleagues at my previous company, another nurse on the team, very smart. She went to the ER, had severe abdominal pain, ended up having a CT of her chest and abdomen, trying to figure out what was causing the severe pain. They realized she had acute appendicitis and they emergently rushed her to the operating room, all of which they should have done, right? On that CT of the chest, they noted the radiologist called out, you have a significant breast lesion, needs ASAP follow-up, suspicious for malignancy. Unfortunately, there was no process or system in place to catch that. They caught the emergency, they got her to the right place, but nothing set up to be like, oh, holistically treating this patient, we need to address this as soon as she's well enough to receive this information or get this to her primary care doctor to make sure that this is followed up on. None of that happened. So 10-month delay to diagnosis and treatment. She just happened to go for her regularly scheduled mammogram and they caught the lesion again. This time when they did additional imaging, they found out she was metastatic breast cancer. It had traveled to her brain and was now an inoperable brain tumor.
Oh my goodness.
That's horrible.
Oh my goodness. Yes, devastating.
So that was like our first moment where all of us looked at each other and we were like, is this a problem? Like, is this a one-time thing? Does this happen? We couldn't believe that this was happening. But if you break down the health system, I'm sure Laura and Catherine, you guys have broken down the health system plenty on your side of the business. There's so much like lack of communication, lack of care coordination, siloed information, lack of communication amongst the teams. And really the person who pays that price is the patient in the middle. And so Jill ended up passing away in 2021 after she fought hard. But that was the impetus and the mission behind our company. So to your point, there's a cost to this. Many times it's the patient that pays that price. The cost for the health system is large too, as you can imagine. Many of our health systems that we serve and many that are in sales process right now, they have been sued on multiple of these cases of not just failure to diagnose, which is its own separate thing, but failure to or delay to treatment when there was already a relevant piece of information that needed to be communicated to the patient and the provider and just was not. So that legal limiting of liability is a big value statement for what we do. Because if we tell that story differently, now with Inflo Health in place, she would have gotten a text message from us within 24 hours saying, hey, you have an incidental finding that was also found on that report, and here's what we want you to do next. We would have also sent a notification to her primary care doctor and said, hey, your patient was in the ER yesterday and is going through a pathway there, but has this very concerning lesion that needs follow-up. Would you like to order this now? Like all of those things would have automatically taken place within the Inflo automation. Not even one human would have had to touch that. It just would have automated to the next step. Then we would have tracked that. And let's say nobody did what they were supposed to do over the course of the next 3 weeks. They would have gotten another message from us saying, hey, would you like to engage in your care here? Would you like to go back to your primary care doctor? And primary care doctor, would you now like to place this order? And we would keep bringing that to the attention until it got done.
Okay, so explain to me the actual technology with Inflo Health. Who is coordinating that? Like the hospitals are integrating that into their systems there at the hospital, so the patient's like automatically enrolled in it. Like the patient doesn't have to do the extra step, right? Like, Jill's story, absolutely devastating. And obviously, if she's dealing with an acute appendicitis, she's not thinking to check off paperwork to send her cell phone out to then be alerted to things down the road, right in the moment. Like So the contract is with the hospital. Like, walk us through that process.
Yeah, the contract is absolutely with the health system and the hospital. As you can imagine, this ER workflow that I described is our number one workflow, because if you go into the hospital today, go into the ER, about 60 to 70% of patients get some kind of imaging done during that visit, trying to figure out why they're in this emergency situation. Our imaging has gotten so good, and as you guys know, there's AI layered onto detection now. So our ability to pick up what's called an incidental, which is this is not the reason you're having this imaging done, but it's very concerning and it needs additional diagnostics done. Those have increased by 38, 40% in the last 5 years. The hospital didn't necessarily have staff to do anything more about follow-ups. And so this is definitely a lagging piece to, we turned on all this great detection to make sure we didn't miss a thing, but we didn't really have a pathway set up to support that. And so when we contract with the health system, number one, we consume all of their radiology reports in real time via an HL7 interface. We look through those reports, we read them in real time using our own language model that's proprietary to us and what's called natural language processing. We take all of those follow-ups and we organize them into smart automated work lists by type. So this is a breast lesion, it goes here. This is a lung lesion, it goes here. This is an incidental that falls outside of those two programs, it goes here, and on and on. Each one of those during implementation, we work with their clinical and quality teams to set up, okay, this patient type, where do they go? What do they need to do? What's their next step? How do you want us to guide and direct their action? We feel very strongly, Catherine, that number one, the patient needs to know that they have a finding. They might not know what to do about it, but they need to know and they need to be active in their own care. And then the provider needs to know, and it needs to be the right provider. It can't be that this is going back towards the ER provider that's trying to solve whatever's going to kill you in the next 24 hours. It needs to go back to the practitioner that is long-term treatment path for this patient. And so if they don't have a primary care, enrolling them in primary care becomes sometimes our next step, or taking that primary care doc and saying, hey, your patient knows, you need to take the next action, which is this clinically indicated for this patient? Make that decision and help us put an order in to make sure that this gets done. So we're really coming at it, Catherine, from both angles, and it is the health system that's driving that action.
Wow, that is so cool is the word that comes to mind, Angela. It's not that's so basic when you think about what's being done, but it is. It's triaging those things because you would think, an EMR system within a hospital would maybe be talking to each other some, and it wouldn't be so siloed in terms of what the patient comes in for. But that's not necessarily the case. It's not picking up on some of these follow-ups that need to occur. And it's like it's like an automated patient advocate for, if they don't, so it's someone that's advocating for them to get the follow-up and kind of reminding them to do it. When we talk about AI and we can call it predictive analytics too, but there's obviously limitations on what it can and cannot do. And I think healthcare as an industry is still very much figuring that out, what can and can it not do, and when does clinical decision making need to come into play. I'm curious your thoughts on that, because this is obviously, Inflo Health is an amazing thing that you're very bought into. It's, what it does for the patient, but there are obviously limitations to what any AI can do in the healthcare space.
100%. And I agree with you wholeheartedly. I think I listen to a lot of CEOs of health tech companies, like they're talking about like they're the quick fix, they're the easy button, they're going to solve it all. And I don't believe that at all. In fact, I've seen the opposite be true. If you don't have good people and process set up before you bring in technology or in combination with that technology will likely fail. Just having more data does not translate into anything on the clinical end. And so we realized that. And with this company, we partnered with the American College of Radiology, which is our governing body. Obviously, they're the ones giving accreditation towards all of our health systems. They, a lot of times, are the ones putting out most of the guidance and guidelines that you guys would look at in a case like this. And they have something called the Empower program. It was two people out of Stanford, Candace Tompkins, and also Dr. David Larson, that created this quality improvement program that you can put a team through to create the people, the process, the multidisciplinary approach to be able to bring something in like a technology, run a quality initiative, have all of the data at your fingertips, and be able to continue to iterate on that process in a high reliability methodology. And so when we partnered with them, we were the first vendor that they really had at the table. It was a they were like, wow, you're a vendor and you like don't think you're going to fix everything. And I'm like, no, we understand that like as a technology layer, here's what we can solve. But like the people in the process and everything has to be married together to make all of this work. And so they've been phenomenal partners. Every single client, we pay for that subscription. It's a 6-month program, and it has had phenomenal success for our clients just to be able to understand how to successfully bring in a technology that is AI driven and make it impactful, and what people processes need to be put in place around that to make sure that it is a success. So absolutely agree with you. We're not an easy button. There are things that we're very good at, like querying tons of data, reading through it in real time, highlighting it to a work list, sending out a text message. All of that is super easy for AI and automation to do and takes that workload off of the team and the manual, like, oh, I'm digging through Excel spreadsheets all day and like manually picking up the phone and sitting on hold for 8 minutes. Like, is that how we want our clinicians' time spent? No. So taking all those manual tasks and then what we call promoting the human to the top. So we think of it as a pyramid. AI is at the bottom, automation is the second layer, and the human is at the top. Like, how do we continue to promote the human to where they're just orchestrating the tech and the AI? They are using their expertise and their knowledge that was so painfully gained over their career and making sure that they're using AI and automation to their advantage and not in reverse. We don't think it should be the AI that's guiding care. We think it should be the human that's still guiding care, but making them as efficient and effective in their decision-making process as they possibly can be.
Yeah, that makes so much sense, Angela. It's not a replacement, especially in the healthcare space. I know that some perceive that potentially in some other industries, but it's not, and it really can't be. To your point, it's an enhancement to the human aspect of it. So I love that explanation.
Good.
And it's help that hospitals and clinicians could certainly use with their, current nursing staffing shortages, right? And everything that's happening to our hospital ecosystem here across the country. So I understand y'all recently won an award. You were recognized for the Digital Revolution Award for Excellence in AI. I want to know a little bit more about that. And I also want to know, I'm assuming that would then help you with your brand equity as you're having these conversations with hospitals, because personally, just hearing about this technology, like I want to know that my provider has that or is choosing that for me, because an extra set of eyes, AI or human, can only help with healthcare outcomes.
Absolutely. I am quite honored to win that award for the team, and we've done an amazing job to get to that point, and I don't want to devalue that at all. You guys know we don't set about to win awards. We set about to build the best possible workflows that save patient lives. But getting a recognition like this is for sure in an AI revolution, which we're in the middle of. It's hard to win these awards and hard to be recognized. The way that you win these awards is that your clients and your hospital systems and your users are having such a high degree of success that it's putting all the other noise and vaporware kind of aside, which right now there's a ton of that. And if you don't know what vaporware is, it's people who are saying they're doing a thing and they don't actually do that thing yet. They're selling to a concept, they're selling to a theory. And there's a lot of that going on in AI right now. So how do you tell the difference between the people who are actually doing what they're saying they're doing, and the people who are giving you a really slick, great marketing demo and making you feel like the possibilities are endless? And it is like making sure that you have those clients and hospitals that are experiencing the success. We sell against people all the time that are literally pop-up companies overnight with things called vibe coding and et cetera. And like, you can't even figure out a history on that company. And they're out there selling what looks identical to what you do. They haven't built any of it. So what you're really trying to do with these awards is separate yourself from the pack. Like, who is really out there doing and having success and has become clinically and operationally outcome driven and valuable versus who is just saying that they're doing a thing and they're selling a super slick demo. So these awards really help us to show that. And that's what we're after, is every single one of our client success is our number one mission and goal, is making sure that we're driving towards success every day. These awards just help us kind of prove that out.
That's awesome, Angela. Yeah, congratulations.
Absolutely. And I feel like I'm going to go do some research or get you offline here to find out if our hospital systems here in South Carolina have partnered up with you yet. Because Lord knows all women everywhere can relate with Jill's story and would like to see better outcomes in her honor there with the company that you have helped to get off the ground. So Angela Adams, CEO of Inflo Health, thank you so much for joining us here today for this important discussion. Maynard Nexon attorney Lauren DeMoss, thank you for your time. I'm Lynnsey Baker, and we'll see you right back here next time for our Taking the Pulse podcast.